Dr. Judith Joseph, how are you doing today?
Good. How are you doing?
I'm doing great. I'm so happy to have you. I have your book in front of me, High Functioning. And this is what I see a lot in my own clinical practice, particularly with women who are, it's not the classic depression, can't get out of bed at depression. It's the still going because they have priorities and obligations and families, and yet it's all flat. They're lacking that motivation. They don't feel like they're thriving and they're just surviving to get through their day. Is this a lot? I haven't been able to dive deep into the book, but that's kind of what I'm thinking that a lot of this, how we're defining this high functioning depression.
Yeah, a lot of us don't cope with our feelings of sadness or stress or overwhelm in ways that we classically think people cope. A lot of people think, oh, you shut down, you don't get out of bed. But many of us can't afford to do that. We push through our pain, we show up for others, we're the rock. We can't say no, we're people pleasers. And eventually something's going to give. Either our bodies break down or we end up experiencing a clinical psychological breakdown. And I'm trying to get people to recognize the warning signs so that they can do something about it before they break down.
Can we dive into the warning signs? And I'm really curious. I work with women in perimenopause and menopause, and I find that particularly in peri, symptoms around mental health can be very cyclical. So there will be times in their month where they are flat. And I can speak from personal experience where I'll wake up and yesterday was fine. Everything was fine. I mean, the problems to solve and the things to deal with, like that didn't go away. But my ability to cope with all of it, it's like I wake up or I have so many patients that say all of a sudden life feels insurmountable or that they're experiencing a deep sense of dread. It doesn't mean that they don't get up and do the things that they need to do. Can high functioning depression be cyclical? Can it be hormonal? I'm just curious.
Yeah, well, in my book, I do talk about something called the biopsychosocial model. So if you imagine like the biology part overlapping with the psychology part, overlapping with the social, and like you envision like a Venn diagram,
Mhm, mhm.
biologically, a lot of people who go through perimenopause and menopause experience that stress, and that's where they're losing their joy. And so I often say, understand the science of your happiness because the science of your happiness is going to look different than the science of maybe like your colleague who's a man. The science of his happiness looks different. He's not dealing with the biological component of having hormonal fluctuations at the extent that a woman is experiencing or someone who's biologically having, that those estrogen and progesterone shifts. And so when you think about the science of your happiness, most definitely people who are experiencing hormonal fluctuations may experience anhedonia, which is, a lack of joy, pleasure, things not lighting you up the way they used to, feeling flat, feeling meh. And we often, get it confused with burnout. Like people say, oh, I guess it's just burnout. I gotta, like take a break from work. But even when you're outside of work, the symptoms don't get better. And so I think understanding that, depression has many faces, many causes. And for people who go through perimenopause and menopause, they often mask how they feel just to, show up for the job, for others. And so they often, have this underlying high functioning depression that is made worse or caused or, where hormonal fluctuations are contributing to it, most definitely because of that biological factor of the biopsychosocial. When you look at the biopsychosocial, the psychological part that deals with trauma and past psychiatric history and so forth and psychological stressors. So people often have histories of trauma that they don't think about, they don't want to acknowledge. And women in particular have high trauma risks because of the high rates of sexual assault and so forth and childhood sexual abuse and so forth. So, when you think about the biopsychosocial model, it's really important in understanding the science of your happiness and the social factors, right? The social factors of being a mom, a career person, taking care of elderly parents, all those social burdens also play a role. So there are many contributors to losing your points of joy and also to high functioning depression, particularly in women.
Hmm. So I can, like, as you are laying that out, there's so much complexity. It's no wonder there's so much misdiagnosis. And I was thinking, maybe a woman is kind of holding it all together. I'm assuming there are gradients of high functioning depression as well. And so maybe it's on a lower side, but then as hormones begin to decline and our brain is shifting, that it becomes more predominant. I always say that we have this protective hormone shield. And then as it goes, all of a sudden everything just it comes up for review, especially if there was trauma that you haven't dealt with before.
Yeah, and there's a known link between trauma and depression in the menopause transition because when you think about trauma as being a stress on the brain and the wear and tear that happens on the brain, then your brain is becoming more vulnerable to other things that expose, protective factors. So like if your brain's already been through years of trauma and not really recovering, and then on top of it you have another vulnerable period due to hormonal fluctuations, then it makes sense that a history of trauma worsens your symptoms, right? In the menopause transition and in perimenopause. So knowing this is helpful because, especially with my patients who have, let's say PTSD, what I'll do is I'll say, hey, you're like in your late 30s, early 40s. We have to think about doing things to help you and support you as you go through the transition because you're going to be at higher risk. And the same thing to my patients who are Black and brown. I'll say, like, hey, like, you're probably going to go through perimenopause and menopause sooner with more severe symptoms and longer because there are those risk factors likely due to trauma as well, because these are highly traumatized groups. So let's do things to prevent you from having severe symptoms, or let's try to alleviate the symptoms as best as we can. And so if people are, if they know that this is going to happen, or if they're at higher risk, then they can actually do something about it. They can start to get better sleep. They can start to address certain toxic habits that may not be helpful, like smoking and drinking excessively. They start to lift weights and address their diet differently because all of these things are protective. Maybe get rid of those toxic people who add to the stress on your brain. When you know what to expect, then you know how to prepare. But if you don't know, it's harder to prepare.
I really do appreciate that. Like basically getting us ready, preparing for what is possible. So if you have a history of trauma or you've got severe stress as a younger person, which probably lended to that as well, and you're a woman, note that you're probably coming into a phase, whether it's perimenopause into menopause, where some of that's going to become more like it's going to really show up and to be ready for that. So I'd love to talk. I want to go back because I was just curious because this is just so much of what I'm seeing. It's the mental health piece that a lot of my patients are coming to me for when they're navigating this journey. And they're just trying to get through the day to day, but they've also noticed those cyclical changes. Like in the beginning, it's all of a sudden, 5 days out of the month or 10 days out of the month, they're really struggling and then things get better. But then over time, as we progress to menopause, it just gets very blurry and it becomes more consistent. What are some of the subtle symptoms or even the general symptoms of high functioning depression? Because again, we do have this sense that we can't function, we're lethargic, we have apathy, but I know that it's more nuanced than that.
Yeah, well, in my clinical research study, the first in high functioning depression in the world that was peer reviewed and published, we looked at symptoms of anhedonia. So that's like that numbing, that things don't excite me anymore. I'm not really enjoying things that I used to. That's really like a hallmark symptom. But we also look at the other classic symptoms of depression. We look at your energy level, whether or not you're able to focus, feeling guilty, hopeless, not getting great sleep, not having an appetite like you used to, feeling bad about yourself. And so all of these things are the symptoms of depression, but the difference between a high functioning depression and a clinical depression is that in clinical depression, when you like bust open the textbooks, you'll have all those symptoms, but you also have to either break down or have diminished or lower functioning or be in crisis or in significant distress. But with high functioning folks, you can have all those symptoms and not break down, but actually cope by pushing through and being overproductive. What I find is that when people are going through the menopause transition and they've lived with high functioning depression, initially they start to push through. Initially it works, but eventually something breaks down. So, eventually the hormonal fluctuations either cause the sleep to be so poor that like you can't continue, or, the brain fog symptoms cause the concentration to be so difficult that you don't function as well, right? Those physiological fluctuations in the hormones lead to these symptoms that actually are enough to, you know, cause you to stop functioning the way that you used to. And then you're like, well, what's happening? And what ends up happening, what I typically see is that people end up going to their doctor and getting like an antidepressant or a treatment like a mood stabilizer, and it's actually not addressing their symptoms because what they actually need is hormonal support. And that's where it becomes so confusing because if you have this history of like living with a high functioning depression and then you go through perimenopause or menopause, oftentimes you'll end up getting treatment with an antidepressant, which may actually help, but in many cases doesn't. And so what you really do need is that hormonal support.
Yeah. Yeah. I see that all the time. I think, what is it? 61 million women are on antidepressants or an anti-anxiety medication a lot in this midlife transition where that's the thing we think women are needing when it could possibly be the hormone support. So, Dr. Judith, one of the big questions I get a lot of my women, well, I think a lot of people are struggling with trauma to begin with. And the adaptation of that trauma for many of my women is overdoing, being high functioning. I remember when I first saw your book, I was like, oh, you mean just, I kind of joke. I'm like, oh, that's just my trauma operating. Well, that's an adaptation of productivity is equal to my worthiness kind of a thing. And so I was curious, yeah, how do we distinguish between someone who is highly productive, driven by trauma versus highly productive and really struggling with depression? Yeah, are there distinctions between the two?
Yeah, the people who are highly driven and enjoying what they're doing and not experiencing the anhedonia, I say like keep going. That's great. But many times you have people who are highly functioning, overproductive, and they don't enjoy it, but they don't know how to slow down. And I often say that when they sit still, they feel restless. When they're not busy, they feel empty. And they're like, oh my gosh, that's right. And they don't enjoy it. They have anhedonia. And when I explain trauma and trauma responses, I typically say like there are 30 plus symptoms of trauma. People often think, oh, there's hypervigilance, there's nightmares, there's avoidance of people, places, and situations. But I remind them that you can also avoid dealing with your pain by busying yourself, by never slowing down. And that's your avoidance. So it looks like you're productive, but I call it pathological productivity because the productivity is actually you trying to outrun something you haven't processed. And that feeling of low self worth, I don't think a lot of people know that that's actually a hallmark symptom of trauma, that you're enough on your own without having to do all these things for others. But people who have experienced past trauma often feel as if they have to do for others and overperform in order to feel worthy. And when you know that that's what's correlated to your busying, and you try and challenge that by actually taking the rest that you deserve and that you're worthy of, that's how you start to heal. But if you don't ever realize that or recognize that, then you continue doing for others, you continue busying yourself, you continue people pleasing until your body breaks down.
So at some point, the body's going to break down, whether you're being
Eventually.
driven by trauma or being driven by something, whether you're running from something or just trying to maintain and survive. Are the strategies that you are recommending for high functioning depression, are they similar for, most of my people are women. Are they similar to trauma driven responses as well? Do you find that they are similar? And do you find that women have both?
Well, some of the tools in my book address trauma and some of them don't. And because trauma is a risk factor for depression in general, I wanted to include some of those tools in there for trauma, but I also include tools in there for just slowing down and tools for reclaiming joy because, not everyone has significantly life altering traumas. Some people, maybe they just forgot who they were. They lost sight of what their values were along the way. And there wasn't anything in particular that was very big that happened, maybe a small trauma, but nothing that shifted the way that they view themselves, in terms of not being worthy, but maybe they were being rewarded by the external world for things that they thought were valuable, but they still feel empty. So everyone's different. And I include tools, that are trauma focused and also tools that are not.
Awesome. Okay. I would love to take a moment because I know you do such a beautiful job on social. This is where I get to follow you and get to learn and all the things. Like I loved recently how you looked at the different generations and how we address being sick, and and I was like, oh my gosh, that's me. And so it was just really interesting. But defining happiness versus joy, because I think a lot of people, we think that they're one and the same and they're not.
Yeah, and generations look at the two very differently too. I did a recent generations reel or TikTok on how generations define happiness. And that one, I didn't realize it had gone viral until a reporter had reached out to me from Newsweek and she was like, "Did you know your video went viral?" It's like everywhere. She was based in London. So I had to go back a couple of months and I was like, "Oh, that's why my follower account is going up because that video went viral." And it was like super old. But yeah, basically I looked up how we define this idea of happiness. And many people in like the non-research world will say, well, happiness is when I get this house, or when I finally get the big job, or I finally have the dream partner, or I finally have a family or a career. It's always this thing that's external, and that's happiness. But we know it. Like when we open up our phone and we see pictures of people smiling and they have the house and they have the kids and they have it all. And especially if we know them and we're like, I know your life isn't happy, right? We know how easy it is to get caught up into this idea of happiness because that's what it is. It's an idea. And joy, on the other hand, is an experience. It's joy is, when you sit and you like can actually like taste your food and savor it. You're like, wow, like this is delicious and I get to have this. Or like when you look at your kid at the end of the day and you're like, you're really listening to them and you kiss their cheek. My daughter has the chubbiest cheeks and she's 9, but she still has her baby cheeks.
Oh,
And you're like, oh, like how lucky am I to be your mom? It's those moments that are really joyful,
yeah.
like, and those are not the moments that you can like snap a picture of. Like, yeah, you can take a picture of food and post it, but it's not going to be equivalent to tasting that delicious sushi with the roe that bursts in your mouth and you're like, wow, like this is so good. I wish I had a friend here to eat it with, like things like that are
Mm,
joyful experiences. And so I often say that, that these are things that are like priceless, but we often look for the things that have the price tags and like the things that we can quantify. But so joy is that experience that we often take for granted, those simple human pleasures. And when you do the research and when we conduct this happiness research and we're asking patients like how we're trying to measure whether or not they're getting happy or whether or not they're staying the same, we'll ask things like, oh, like when you connected with your loved one, did you feel seen, heard? Did you feel loved? Did you feel connected? We don't ask things like, oh, like, did you find your dream partner? Because we know that that's not how
it's
you
not
measure
cutting it.
true happiness,
Yeah.
So think about those moments in your day where you're like totally leaving your joy points on the table. Like,
Mm.
are you leaving your joy on the table because you're eating your food in front of a screen and scrolling through, like news reel after news reel, but you're not really savoring your sandwich, right? Or you're home and your kid is at the dinner table, but your mind is still at work and you're missing out on this story that you find irritating, but it's actually your child trying to connect with you. And if you actually were present and listened and didn't jump in and didn't get distracted, you'd realize that your child is really trying to bond with you and you don't have these moments. You don't have many of these moments, like, or like you're at home and your dog comes up and licking your hands and like yapping at you. And you're like, just a second. And you're like irritated and you're just like pushing the dog out the way. But it's like, but that dog loves you and has been waiting all day for you. So savor that moment versus being still upset about what happened at work earlier, right? So it's all those little moments that we kind of take for granted that if we savored them and if we really valued them with intention, we would actually feel happier. But we're so busy chasing these ideas and posting about it that we don't realize that we're leaving the experience of joy on the table because we're too busy chasing happy.
Mm. Yeah, I agree. Joy is like spontaneous, but you have to be present to feel it. I agree. My son's just 4. He'll tell you he's almost 5. I'm almost 5. And he loves swinging at the park.
Mm.
And we'll be at the park and we're at the beach. It's a little beach park and the sun will be setting and he'll be just giggling, and it's just that moment to be in that, like there's these punctuations of presence. And I think gratitude, do you talk a lot about, I feel like joy and gratitude spiral together a bit.
Mhm. They do. If you're intentional about those moments and you savor them, you're essentially being grateful for them. Gratitude practices are really helpful in kind of staving off high functioning depression or sustaining your joy. It's hard to be grateful when you don't know what brings you joy. So like the anhedonia part of it is, learning about how to trace back to those moments that actually brought joy, how to figure out what it is that brings you joy. But once you figure that out, planning that joy in the future And moving towards that and putting them on the schedule is a way of practicing gratitude because you're like, okay, this is something I need to honor. It's something I have to plan. It's something that, I have to prioritize because the alternative is not having those things. And if I make space for it and I'm intentional about it, then I will become happier, because I'm really honoring it and prioritizing it.
Hmm. Let's say you have somebody who, yeah, had a really crap day at work and comes home and has a family and all that and is caught up in the mess of just the day that happened to them, not happened for them. Are there ways that we can transition, like shift our state? Like, let's say we're in the car, we're about to step into the house, and we don't want to bring, let's say we're aware enough that we don't want to bring that into the household or into the presence of doing the puzzle with your kids or whatever it may be. Maybe you guys are making muffins together. I don't know. Is there techniques or strategies that we can be thinking of that can shift our state so that we're not coming in, bringing all of our junk with us?
Yeah, for emotional dysregulation, there's these really great tools in this type of therapy called dialectical behavioral therapy. And a lot of that is mindfulness and, trying to retrain your brain how to get back into your body even when you're very dysregulated. And so I always start with the senses. And if you are in a place where you can do this, great. Like if you can say, hey, family, I need 5 minutes just to myself. But a lot of us don't have that. Like I know when I get home, my 9-year-old's like, Mom, ah. And she's like,
It's amazing how many
there's,
things they can ask of you in like less than a minute.
yes, there is no break. But what I've started to do is I'll say, I need 5 minutes just for me just to like get out of these scrubs because I still wear scrubs. I do research and we do blood work and all that stuff. And we work with patients in person. And so like my babysitter knows like mommy needs 5 minutes. So we'll do that, have this 5 minute time where it's like, okay, I'm going to take my scrubs off. I'm going to wash my face. I like have this routine and I'm going to be like really into my skincare. I love skin products. The nice thing about being in the women's health space is that you get so many like you get so many
Selling you skincare.
yes, I
Awesome.
get so many products and I get to try them out and it's like my little thing, right? And so like it's my time and my daughter's always like literally waiting outside the bathroom. Are you done washing your face? She knows. So I'll be washing my face, then I put on my products. I put them in the right order. I have my little routine, and it's my way to decompress, and then I'm ready. But for someone else, it could be another practice. It could be changing your clothes and getting into that, after work cozy outfit. Some people can't be in their work clothes all day. They have to change right away,
Yeah,
right?
I know. I try to get out of my clothes pretty
I do too.
Yeah. I was gonna
I'm
say,
right
do
to the
you have,
comfy stuff.
yeah, they'll wear the comfy stuff and then do the beautiful skincare routine and you're ready. You're ready to go cook dinner.
And I'm ready. But for others, it could be something else.
Yeah.
I once had a patient where as soon as they got home, their practice was because they had lots of little pets, they'd like, feed the fish, water the plants. They had their whole setup and that calmed them down. That allowed them to feel, self-reflective and to feel as if they were self-regulating. For others, it's going to be something else. So figure out what that practice is and stick to that routine. And, we are all living organisms. So once we get into this practice and our brain gets conditioned to entering the home and doing something, it just becomes a part of our way of life. So I would say try those things to stimulate your senses because when your brain is so overstimulated and your emotions are so dysregulated, keep it basic to your five senses. And that's actually taught in that type of therapy, dialectical behavioral therapy, where they will literally have these like soothing senses boxes where you have different ways to stimulate all senses to help self-soothe because when you're dysregulated, it's hard to actually make good decisions or decisions that you are proud of. So like start with the senses.
I love that. I take it that's in a way sending safety signals to the brain that everything is
Mhm.
okay.
Yeah, it's another way to really take advantage of the mind-body connection because when I'll use my practice, for example, like when I wash my skin, I'm doing it in a very gentle way and I'm intentional about how I treat my skin. And, when you're gentle with yourself and you're putting on these creams and so forth, you're literally sending this message to yourself that you're worthy of love, care, and attention. The oxytocin hormone, gets released. You're doing things in a way that is actually improving that mind body connection. So be intentional about it. If skincare is not your thing, do something else. Maybe it's like making a cup of tea and just being present in that moment and smelling the aroma of the tea and sipping that tea and feeling that warm cup in your hand and slowly taking in this, tea in a ritual way that is showing yourself that you're worthy to slow down and this is your time. Whatever it is, whatever your practice is, be intentional about it.
Mm, I love that. And it can just be 5 minutes or less.
Hmm.
Let's say that we know somebody that maybe hasn't identified that they are struggling with high functioning depression. And I feel, gosh, I don't know. I always feel like we're quick to identify someone else, versus what's going on with us. But let's just say we know someone in our life who is struggling, but they're going through the motions and surviving, and they're kind of not willing to slow down or kind of figure out what's going on with them. How can we show up? Maybe it's a family member or a friend to show a bit of support and to help them kind of find peace.
Well, just know that this person likely won't reach out for help because one of the symptoms is feeling like you're a burden and not wanting to burden others, right? Because you are typically used to being a people pleaser or you're the one that helps others. So it feels uncomfortable to ask for help and to have other people go out of their way to help you. So know that that person likely will not ask for help and just place yourself as this reminder in their lives. Like, remind them that like you don't have to do anything. You don't have to be the rock. You don't have to show up. I'm still going to be here. I love you and I'm here for you because of you, not this role. And by you saying that and reminding them of that and not expecting much, that will send a message to their deeper brain that like they don't have to be all these things, right? The other thing is to help them meet their basic needs. Many times these are people who are so busy taking care of everyone else that they're neglecting their basic needs. They're probably not eating properly. So, doing things like bringing over something nutritious for them, know that they're probably not resting. So, like showing up and helping them and saying, oh, actually, I got this, don't worry about doing that. All those ways are allowing them to have the space to acknowledge that they are human beings, not humans doing. And I
Mm.
think that's a language that they can understand versus, hey, you're struggling, let's talk about it, because they may not be ready for that. And that might actually make them feel very ashamed and not want to open up to you.
I love that. I love the idea of maybe bringing them a tea or making sure that they're hydrated or bringing them a healthy lunch or dinner or helping to set them up so that they get a good restful night's sleep. I can imagine people, particularly women who are operating as a high functioning depressive person, that they are definitely putting themselves last, that they're much more self sacrificing. And that level of support of just helping a little bit move the needle for them to take care of themselves, I bet just moves mountains.
Yeah, especially when they're caregivers. Like if you can take even an hour or two off their plate where they're just like resting or doing nothing,
Yeah. Yeah.
that can be very helpful for them.
Also, I think just all the women listening to this right now who are the caretakers and the doers and handling all the things and the sandwich generation that you had mentioned before. I'll tell you what, when my partner brings me a coffee or has a smoothie outside my door, I am so elated. I'm so happy because I was like, I don't know when I was going to eat. I really have no idea how that was going to happen.
Yes, absolutely. Those little things, they send that message to you that, like, you're worthy of rest, you're worthy of a break, you're worthy of meeting your basic needs. And
Mhm.
so when you have people around you reminding you of this, it helps you. But if you're in that zone and you don't slow down, you're pathologically productive, you won't stop. You'll just keep going until something breaks down, either physically or mentally.
Dr. Judith, how often do you see that? Is that often when your patients are coming to you with kind of when they hit a wall? I always call it the Mack truck moment.
Sometimes, a lot of times I'm in New York City, so I see a lot of people who are pathologically productive and they know something is off, they just don't know what it is. So they'll say, everything in my life seems great. Why am I not happy? And they're functioning, they're over functioning. So sometimes it's those people, but other times it is, people who have been pathologically productive and then either there's something physical happening and then you can't figure out what it is. And then they see me and there's a combination of something physical and psychological, or they eventually do break down and they're no longer high functioning. And so, I see the range of how it could all, go down. But I do think it's important for people to understand what their risk factors are and what areas of their life need to be prioritized. So, for example, if biologically you're someone going through perimenopause or menopause and you're just, struggling, well, then maybe that's where you need to put your focus, right? But psychologically, let's say if you're someone who has unprocessed trauma and now you're just at a point where you need to deal with it, that's where you need to focus. Or, like socially, if it's what's happening in your life, maybe the workplace or maybe a partner who's not the best for you, like, or maybe even just, the way that you're eating and your habits, figure out where you want to focus because we all have a very unique biopsychosocial. It's like a fingerprint. We all have a fingerprint, but all of our fingerprints are unique. So we all have biopsychosocials and every single biopsychosocial is unique. So figure out where it is you want to put your efforts.
Mm. As you were listing those things, I think about a lot of my patients who they're like, I check all those boxes. And so they're like, where do I focus?
Yeah, you want to figure out where to start. So, like for some, again, let's say you're going through the hormonal shifts. You could eat all the kale you want, in the social bucket, right? But it's not going to change that, It's
Yeah.
not going to change your hormonal shifts. And you may want to start with the hormones because we know that of the correlation between the trauma and your mental health symptoms during this very vulnerable transition. So maybe that's where you want to start. And then once that is regulated, then you start working on the other two, or you prioritize one over the other. But for some, maybe their hormonal shifts aren't that significant. And a lot of times you can tell based on the physical symptoms, right? If you're not having as many physical symptoms and you're able to, get through, then maybe that's not where you want to start. Maybe you do want to get support in other areas, like the trauma component. And so everyone's going to be different. It's helpful to work with, a specialist who understands. But, many people will say, well, the hormones are safe and relatively quick. So maybe that's where you want to start.
Mm. As I was going through your book, I feel like you have so many tools in here, and I feel like you do have a very integrative approach, like as you were talking about in here. And I can imagine someone feeling a little bit lost, like you said, in New York City, where someone's everything, the boxes are checked in terms of like they got the place, they've got the life, maybe they've got the money, but something just isn't landing. They're just not feeling happy or just not having that sense of like well-being and peace. And I would say that the high functioning depression book would be kind of a first place to go to kind of find where it kind of start. But then the deeper recommendation is if you are struggling to work with somebody kind of similar to you. I obviously you are, not that you don't have patience, but definitely more one to many at this point in your journey. Would that be the course of action, especially if someone's finding themselves a bit lost in where to start?
Yeah, and I do talk about that in the last part of my book. Like, well, what if you read the book and you tried these things and you're still feeling stuck? Everyone's so different.
Mhm.
And so if you're someone who, let's say, has like a lot of trauma, you may want to work on whether or not, okay, should I get into a trauma support group or should I be thinking about things like EMDR? Or if you're someone who, let's say, has a past history of, treatment resistant depression, maybe you're someone who's a good candidate for like psychedelic treatment or like psilocybin or other types of treatments, ketamines. Or if you're someone who has a lot of biological risk factors and maybe, let's like some like people with autoimmune conditions, like then you want to focus on working with a team that understands your unique picture. But everyone has this such like a different biopsychosocial that you want to do what's right for you. So in many ways, the recommendations are broad because they apply to everyone. But then within that broad recommendation, you're going to tailor it to the individual, which is, I think really important because there's only one you and there'll only ever be one you. So really understand the science of your happiness so that you can make the best decisions for you.
Mm. I was going to say it feels like it needs not only just be tailored, but maybe a little bit of experimentation in terms of what works for you. I know for me, I'm a very hyper vigilant. Have a system that just constantly runs on that, and I have a lot of built-in self-care that I do. I even was on a bike riding by to the beach before this interview. Part of me was like, maybe don't mess up your hair. But like, I was like, you know what? I need this right now. Let me just do this. I got on my beach cruiser and I did this. And then I hopped over to here because I knew that was going to be like, I have a Peloton in the house and I could have got on the Peloton, but I wanted that feeling of being outside, being in nature, seeing the ocean. Like it was going to level me up a little bit more. And so I think that there's a lot of experimentation in terms of kind of what is the deeper need and how are we addressing that deeper need?
Yeah, and that's a great point because many times you feel like, oh, okay, I'm finally ready. I'm going to get help. And then you try the treatment or try the intervention and you're like, oh, it didn't work. And then you feel deflated. But, as someone who's been doing research, especially in treatment resistant fields, like treatment resistant depression, people who've been through multiple trauma treatments and nothing has worked, right? Like there's always something left. So don't give up. You may feel hopeless, but know that there's always something that you have not tried. There's always hope, and that's why I like the idea of support groups because many times you not only help others with your story, but you learn from other people and like they may have something that they've tried and that you've never heard of. And that could be the place where you finally get the relief that you so desperately deserve.
I deeply appreciate that because I just know it can be very nuanced. And I think that's the through line of this conversation today is that it's going to be your own fingerprint of how to address it. And I want to say that Dr. Judith, you do a phenomenal job on social. And I always feel so seen myself. And I know that so many other hundreds of thousands of people feel the same way. And sometimes it's just that little like micro learning lesson can really move the needle in such a beautiful way. And so I want everyone to go and follow you. I'm going to have all of your social accounts listed in the show notes. Where else would you love? I'll have the book link as well to High Functioning because I think everyone should read this or listen to this on Audible. Anywhere else you would love for us to tune into you?
Definitely follow me on socials and, my website, Dr. Judith Joseph. And my book is sold wherever books are sold.
Yeah.
It's in over 12 languages and over 20 countries now. So I'm really proud of that.
Congratulations. That is a big feat. And thank you so much for coming on and joining me today. I know that you're probably heading home after this. And I just want you to know that I so deeply respect and appreciate your time today.
Thank you so much for having me. It's so nice to meet you.
Thank you so much for watching. Now, if you found this video helpful, give it a thumbs up and share your thoughts in the comments. And if you are ready to learn more about perimenopause and how to navigate with a lot of ease and grace, be sure to subscribe to this channel so that you can join our community. Don't forget to share this video with someone that you love, that you know is navigating the perimenopause journey as well, because they deserve to feel their best too. See you in the next video.